I've done several episodes on the differences in psychopaths and sociopaths. So now what I want to do is an episode about the similarities of psychopaths and sociopaths. And the best way to do that is to check out the study. Now, when I do those normal episodes that I do, I talk about the studies in there. And a lot of people don't know where to get them. And when you get them, they're really, really boring. So what I've done here is I've did like the last few psychopath talk episodes. I've taken the study, stuck it in AI, and it squirts out this little thing with a conversation with itself. And it's really fascinating. Now, it's really, really cringy as well, because like I've said before, one of them goes, like I always, and the other one's going, wow, yeah. So if you can get past that, you can learn something here. You can learn a lot more about psychopaths and sociopaths. So I think you'll find this interesting, or I wouldn't be doing it. I've listened to the whole thing, a little conversation that squirts out, and it's great. It tells you everything you need to know about the similarities between psychopaths and sociopaths.
We're specifically looking at antisocial personality disorder, ASPD, and psychopathy. These terms get thrown around a lot, especially in movies and TV shows, and it always makes you wonder, how real is that stuff? Are those portrayals accurate?
I see what you mean. Those terms can definitely conjure up some unsettling images.
Exactly. So how different are ASPD and psychopathy in reality?
You've hit on something really important. They often get used interchangeably, but in the world of psychology and psychiatry, they're distinct.
So not just two sides of the same coin?
Nope, not at all. Even the history of how we've understood and labeled these disorders is a journey in itself. It can get pretty complicated.
Oh, I bet. Like way back, they probably used terms we wouldn't even dream of using today. Am I right?
Absolutely. We're talking terms like moral imbecility or moral insanity, which sounds so archaic now. These terms reflect a totally different understanding of the mind back then.
Wow, moral imbecility, that's wild. But you're saying even today, it's still complicated.
Yeah, even today. There are different diagnostic approaches, which shows you how complex this area still is. For example, you have the American Psychiatric Association's Diagnostic and Statistical Manual, or DSM.
DSM, right, I've heard of that.
Right, and the DSM uses the term antisocial personality disorder, or ASPD.
Okay.
Then there's the International Classification of Diseases, the ICD, which uses dissociative personality disorder. And then we have Hare Psychopathy Checklist, the PCL-R.
Hold on, 3 different systems.
3 different systems, 3 different lenses on these disorders.
Wow, okay. So 3 systems. That does make it sound pretty complicated. So let's break it down. How does someone diagnose ASPD specifically?
Okay, so the DSM-IV, that's the 4th edition of the DSM, outlines 7 key behaviors they look for to diagnose ASPD.
7. Okay, give me some examples.
So these include things like deceitfulness, reckless disregard for safety, and a lack of remorse. It's very much focused on a person's outward behavior, how they interact with the world.
So it's more about a pattern of behavior, almost like a behavioral rap sheet.
Yeah, exactly. A good way to put it. And to be diagnosed with ASPD, according to the DSM, someone needs to meet at least 3 of these criteria.
Just 3 out of 7.
3 is all it takes. Oh, and those behaviors have to show up before the age of 15, and they can't be explained by something else, like, say, a manic episode.
Okay, so that's how the DSM looks at ASPD. What about the PCL-R? How does that work for diagnosing psychopathy?
Well, the PCL-R, it uses a much more detailed list. We're talking 18 criteria divided into 2 factors to assess psychopathy.
18? Wow, it's a lot more than 7.
Right, and it goes beyond just behavior. It dives into personality traits, too.
So what kinds of things are on this checklist? Give me the rundown.
Okay, so the first factor, that's all about personality. We're talking things like glibness and superficial charm, a grandiose sense of self-worth, pathological lying, lack of remorse or guilt, shallow emotions, and a lack of empathy.
Sounds like a recipe for disaster.
It can be, for sure. And then the second factor dives into those antisocial behaviors we talked about. So a need for stimulation, a parasitic lifestyle, impulsivity, and criminal versatility, among others.
So someone with ASPD might make a lot of reckless choices, but the psychopathy checklist paints a picture of like a master manipulator.
That's a great way to put it. And you've hit on a crucial distinction, that potential for manipulation.
I see that.
Both disorders involve antisocial behavior, but psychopathy, it digs deeper into those manipulative, often charming aspects of personality. It's like they can be very good at getting what they want from other people.
Okay, so we're starting to see some clear differences, but I'm guessing there's some overlap too.
Right.
Like that lack of remorse we talked about.
You got it. There is some overlap, especially in those behavioral traits. Both flag things like pathological lying, manipulation, a lack of remorse, impulsivity. So someone with psychopathy, they might meet the criteria for ASPD, but not everyone with ASPD would meet the criteria for psychopathy.
So you're saying it's possible someone could check all the boxes for ASPD,
Yeah.
but not necessarily be a psychopath.
Yeah.
That's really interesting. So how do you figure out who's who? Do they just ask them? Like, hey, are you a psychopath?
Well, handing someone a checklist and saying, tell us how much you relate, would be interesting, to say the least.
I can only imagine.
It's definitely much more complicated than that. We're talking about people who are potentially masters of manipulation. Getting a straight answer isn't always easy.
That's putting it mildly. How do you get a clear diagnosis then?
It takes a skilled clinician, someone who can look at the full picture. They have to compare what the individual says with their actions, their history, their interactions.
Wow, so it's like putting together a puzzle, but some pieces might be missing or even deliberately misplaced.
Exactly. It's a real challenge.
It really highlights how complex diagnosing these disorders can be. But let's shift gears a bit and talk about the criminal connection.
Okay, yeah.
Because you always hear about psychopaths, especially in movies, being linked to criminal behavior.
Right. It's definitely a strong association in our minds.
Yeah, for sure.
Cleckley, he was a pioneer in psychopathy research, and he actually found that all of his patients displayed some form of antisocial behavior.
All of them. Wow.
Yeah, but here's where it gets interesting. While ASPD and psychopathy are both linked to that kind of behavior, studies show that a higher percentage of people in prison meet the criteria for ASPD, not psychopathy.
Hold on, wait. More people in prison fit ASPD, even though we usually hear about psychopathy being linked to crime?
It is kind of surprising when you think about it that way.
Yeah, it doesn't seem right.
Right. It kind of suggests that psychopathy might actually be a more severe subset of ASPD.
Okay, so like all squares are rectangles, but not all rectangles are squares.
Exactly. Or all poodles are dogs, but not all dogs are poodles.
Okay, that makes more sense. So someone with psychopathy would likely meet the criteria for ASPD, but not necessarily the other way around.
Exactly. And remember we were talking about emotional depth earlier? That seems to be a key difference. Psychopathy, it seems to involve a much deeper emotional deficit, one that ASPD doesn't fully capture. It's that profound lack of remorse, the superficial emotions, the callousness. Those all point to a really fundamental difference in how someone with psychopathy experiences emotions. It's like they don't feel things the way most people do.
So how do you predict future behavior then? I mean, if both disorders can lead to people doing bad things, but they manifest so differently.
That's a really good question, and it's a crucial one, especially when you're talking about things like, should someone be released from prison? And this is where the PCL-R really shines. It's actually pretty good at predicting things like recidivism, future violence, even how well someone might respond to treatment.
Really, just from those personality traits and behaviors on that checklist?
To a significant degree, yes. The research shows that those who score high on the PCL-R, they're much more likely to commit another crime. And not just any crime, a violent one.
That's pretty intense. So you're saying this isn't just some theoretical thing. It has real-world implications for decisions about parole, sentencing, stuff like that.
Absolutely. It can give a much clearer picture of the level of risk someone might pose to themselves or others. And that's a big difference between the PCL-R and the DSM.
Okay, I'm intrigued. How so?
Well, the DSM, with its focus on past behavior, it just hasn't demonstrated the same level of accuracy when it comes to predicting what someone might do in the future.
So the DSM is looking backwards, and the PCL-R is kind of like trying to see into the future.
That's a great way to put it. The PCL-R isn't a crystal ball, obviously, but it can provide valuable information about potential risks.
Gotcha. So if the PCL-R is so good at assessing for these psychopathic traits, can it only be used on people who are, already in the system? What about those who might be showing these traits but haven't actually committed any crimes?
That is a great question. And it highlights another difference between the PCL-R and DSM. You see, the PCL-R, especially the screening version, the PCL-SV, it can actually be used in a much wider range of settings.
Really? You mean like outside of prisons and courtrooms?
Oh, yeah.
Like where?
I mean, studies have used the PCL-SV to assess for psychopathic traits in university students.
Whoa, college kids.
Yep. Civil psychiatric patients, even corporate settings.
Corporate settings. Okay, that's a little scary. Like, imagine finding out your boss scores high on the psychopathy checklist.
Well, it's not always quite so dramatic, but it does highlight that these psychopathic traits At least as they're defined by the PCL-R, they can exist on a spectrum, right? They can show up in different ways that aren't always criminal.
Okay. So we've got these two disorders, aspd and psychopathy, different ways to diagnose them, and one that seems to be a better predictor of future behavior. But what happens once someone is diagnosed? I mean, what are the treatment options and how well do they actually work?
That, my friend, is the $1 million question.
Yeah.
And I wish I had an easy answer for you, but I don't.
Yeah.
Treating psychopathy is incredibly challenging. There's no guaranteed cure. But one approach that's been tried is therapeutic community programs.
Therapeutic communities. Where are those, like group therapy where everybody sits around and talks about their feelings?
It's a bit more structured than that. We're talking intensive group therapy. And the focus is on teaching patients to take responsibility for their actions and to develop what we call pro-social behaviors, behaviors that are beneficial to society.
Okay, sounds good on paper, but I have a feeling it doesn't always work out that way.
You would be right about that. Research actually shows that these programs, they can backfire with some individuals, especially those who score high on that psychopathy checklist.
Backfire how?
Instead of changing for the better, they might actually learn how to manipulate the system, how to become even better at deception. They use the therapy designed to help them as a way to hone their skills.
So they're basically using the therapy session to become even better at being them.
Pretty much.
Wow. That's both fascinating and disturbing at the same time. If therapeutic communities aren't foolproof, what are the other options? Like, what about medication? Is there like a pill for psychopathy?
I wish it were that simple. Unfortunately, no magic pill exists for psychopathy or for aspd for that matter. There are some medications that can help manage certain symptoms, though.
Okay, like what?
Well, things like impulsivity and aggression, those can sometimes be managed with medication, particularly in aspd.
So more about targeting the behavioral side of things than trying to completely change someone's personality.
Exactly. But even then, the effectiveness of these medications is still debated. Research is ongoing, but there's no magic bullet, unfortunately.
You'd think with aspd being so focused on behaviors, there'd be more straightforward treatments.
You'd think so, and in some ways there are. Treating the core traits of psychopathy, that's still a huge challenge. But aspd, with its focus on those behavioral patterns, has actually shown more promise when it comes to treatment. And this is where those therapeutic communities we talked about earlier can sometimes be helpful.
Oh, really? So why might aspd be more responsive in that setting?
It seems to come down to what the treatment is actually targeting. With aspd, it's about modifying those harmful behaviors, not necessarily about fundamentally changing who someone is deep down or how they feel.
So it's more about giving them tools to navigate the world in a way that's healthier for them and those around them.
Exactly. Give them a different roadmap, so to speak. And alongside those therapeutic communities, medications, combined with other types of therapy, have also shown some promise in managing aspd symptoms. Again, things like impulsivity and aggression.
So there's hope there. It seems like the big takeaway is that there's no one-size-fits-all approach, right? You really have to understand the individual and tailor the approach to their specific situation.
Absolutely. And that's why research is so important. The more we understand the underlying causes of aspd and psychopathy, how they develop, what factors might make someone more receptive to treatment, the better equipped we'll be to actually help them.
It's like putting that puzzle together, as we were talking about before. We've got some pieces figured out, but there are still a lot of missing pieces when it comes to the bigger picture.
A perfect analogy. And as we find more of those missing pieces, we can continue to develop more effective treatments tailored to each disorder. I think the biggest thing is to remember that these are distinct disorders. Each has its own set of characteristics, challenges, and nuances. To just lump them together, to call them the same thing, it ignores how complex the human mind really is.
I agree. We've really gone beyond just scratching the surface here, haven't we? We've explored what these disorders are, how they're diagnosed, how they're treated, even some of the ethical considerations surrounding treatment, and how our understanding of all this has evolved over time.
And hopefully it's one that will inspire our listeners to keep digging, keep asking questions about these often misunderstood but incredibly fascinating aspects of human behavior.
Here's something I think is worth pondering. We've spent a lot of time talking about the differences between aspd and psychopathy, but where do you think that line starts to blur? How might those gray areas affect how we diagnose and treat these disorders in the future? That's something to think about.